We can put LED lights. Good afternoon, ladies and gentlemen. I'm Bert Eicholt, Health Officer of Mobile County, and I'd like to take just a minute to thank everyone in our community for wearing masks, taking COVID 19 seriously. Schools are starting back in session. We're having athletic events, so please have 6 foot social distancing, wear your face covering, respect others, and let's have a safe community. The COVID 19 numbers are going down, so our community transmission rate is improving, but that is thanks to people taking it seriously. So, on behalf of the health department, our employees, thank you very much. For the healthcare providers who are out doing the heavy lifting, they're doing a lot of hard work and taking good care of the patients who get infected with COVID 19. But the best form of treatment is prevention. Thank you very much, and Dr. Murphy will come in and talk more about current data.
Hi, everyone. It's always nice when our health officer comes and speaks with us with lots of encouragement for continuing to do a good job in adhering to the public health recommendations of wearing your mask and using a physical distance to keep yourselves apart from others who might be spreading COVID. So we'll start again with our numbers on this Friday. Across the globe, there are nearly 21 million cases of COVID-19 disease, with greater than 760,000 deaths. In the U.S., about 5.3 million cases with 167,000 deaths. In Alabama, we have topped 100,000 cases of COVID-19 with 1,821 deaths. So again, we are still very much in the throes of a COVID-19 pandemic, and we need your continued support of the implementation of public health measures to try to slow the spread so that we protect our most vulnerable populations and not overwhelm our healthcare system. So in our daily report today, we are reporting on 10,989 cases of COVID-19. Yesterday, 89 cases were added. 231 people have died. That was an additional of 2 deaths that we learned about since yesterday. For the AIMS data, where we get information from the hospitals, we had a cumulative number of hospitalized with COVID at 1,550. And yesterday around, let's see, it's usually around 175. Let me see if I'm right. 152 people were hospitalized in Mobile County hospitals yesterday, diagnosed with COVID-19. We're hearing that the hospitals are getting a little bit better with the load, the volume of COVID positive patients that they have, but they are still seeing people who are severely ill, needing intensive care and ventilation and those things. So we do expect that we will continue to see extended hospitalizations and perhaps deaths as we continue. And again, this is sort of one of those lag indicators from a couple of weeks ago when our numbers jumped way up. We saw the spike in cases first, then we started seeing the increase in hospitalizations, and now we're starting to see the deaths associated with those cases. So that is in our daily report. You might notice that we stopped reporting on the number presumed recovered because we don't get hospitalization data out of our disease surveillance systems anymore. And so that calculation is a gross underreporting of who is recovered. I think you do the math, an overwhelming majority of people recover. We've had 231 deaths out of nearly 11,000 cases. I will mention that we are, as expected, starting to see more cases in the school-aged children and in infants and toddlers. So more to come on that after we look at our week in review with the expanded weekly report that we send out on Monday afternoon. So a couple more things. On Fridays, we generally report on the number of complaints that we've dealt with this week. So it's gone down a bit. We've had 6 food and 5 retail complaints about people not adhering to the amended safer at home order. That is down a bit. And then for calls about complaints about other businesses, last week we had 15. So that is approaching the total of about 100 businesses that we've contacted, some of them multiple times, to help them, to inform and educate them, to give them the tools that they need to protect their workers, to protect their customers and their, their colleagues, and to keep businesses and retail open. All right, we have quite a few questions today. So let me see if I can get to those. It's really interesting. Some of the comments that we get from Facebook these days are more about me wanting me to remind people about the guidelines and really stating it very well. So I'm glad that there are lots of you out there that are listening and learning and educating yourself and helping us educate others. So I'll start with a couple of media questions. One is about these apps or these processes where we use cell phone as, cell phone locators, so Bluetooth and cell phones as a proxy for exposure. And that, let's see, are we doing enough, how are we doing with social distancing? Are we using cell phone data as a proxy for, being within 6 feet of people? So there is some proximity app work going on in conjunction with the University of Alabama system in collaboration with the state health department. Those things, when they are used, are totally voluntary and totally anonymous. So it's not something that we're not trying to big brother everyone and track their cell phone around to know who they might have had exposure to. But the way it works is if someone declares that they have COVID and they have their cell phone on their person, and you have voluntarily signed up for one of these proximity apps, then if your device gets within 6 feet of someone who's been declared to have COVID, then you'll get a notice to say that you may have come in contact. And it's supposed to be able to tell if there's a drywall between you or a plate of glass or something between you based on the Bluetooth signals, what I'm told. I think that we can always do a better job using the physical distancing to try to protect ourselves, particularly in workplaces. Wearing a mask and being at work does not mean that you can be within 6 feet of someone. If you want to protect yourself from exposure, you need to stay 6 feet away from your coworkers, your church members, your grocery shoppers. If you have someone at your house who's COVID positive, you have to stay 6 feet away in order to protect yourself. It doesn't matter if you're wearing a mask or not. It doesn't matter if you're at home or in a park or in your workplace. I try to remind my coworkers all the time that just having the mask on doesn't lift the 6 foot distance rule. All right. So there have been some changes to the quarantine and isolation guidance that's really occurred a couple of weeks ago, and we are continuing to strongly message about it. So let me try to be as clear and concise as possible. If you are exposed to someone who has COVID or COVID symptoms, so if they're laboratory positive COVID or if they have symptoms of COVID disease and have tested positive, if you've been around that person for a cumulative amount of 15 minutes within 6 feet or more, you must quarantine at home for 14 days. That's the end of that sentence. If you are exposed, you have to go home for 14 days and stay there. You cannot test out of quarantine. In fact, we don't even recommend you test during quarantine unless you develop symptoms. While your 14-day quarantine, if you develop symptoms of COVID, then you have to then stay home for at least 10 days, another 10 days, or until you're asymptomatic, right? 10 days asymptomatic. Anyone with COVID, positive, symptom or not, you have to go home for 10 days. At least the last 24 hours has to be symptom free. So hopefully, was that any better? Was it okay? So I'll say it. I'll say it again. If you are COVID positive, you must isolate at home for 10 days. You can lift isolation, which means return to work, return to school without testing after the 10th day, as long as you are symptom free for at least 24 hours. If you are exposed to COVID, you must be home for 14 days. No testing is recommended, and there is no shortening the 14 days. All right. Let me move on to the next person who's going to ask me that same question. Let's see. Requesting a statement about a movie theater reopening, that we have a movie theater in Mobile. Is it too soon to reopen theaters? If not, what should people do to stay safe? So a decision about reopening any business or any agency, any location, boils down to, can you comply with the recommendations and the requirements in the amended Safer at Home order? If you can safely open your theater and make sure that you have 6 feet of physical distance between every worker, every moviegoer, everyone standing in the line at the popcorn stand, if you can pull that off, then you can safely reopen. But it is very difficult to do those things in some settings. For example, waiting in line, passing through doors, finding a seat, those sorts of things. So you have to think about limiting capacity, limiting workers, think about workflows, one directional movement. I wish every grocery store in Mobile would have enter one-way directions down the aisles and exit another door. So there are some best practices out there. So it's not for me to say whether or not it's too soon for movie theaters to open, but it all boils down to, can you implement the measures necessary to protect COVID from coming into your facility and spreading in your facility? And if you have questions, you're not sure what the guidelines say, contact us and we are happy to help. Send an email to covid19@mchd.org. All right. Someone has asked why our county statistics don't show ethnicity. We only display race. And the reason for that is, even if you look at our race numbers, you will see that a large proportion of them are unknown, because we have so many cases. We're always behind trying to call and get them on the phone to ask them what their race is and many other questions. We don't get that information completely from healthcare providers or laboratories. And the data for ethnicity is even more sparse. So we only have data on Hispanic or non-Hispanic ethnicity for less than 2% of our cases. And so we just don't believe that sample size is enough to put any amount of confidence in that data. Let's see. Okay. Yeah, I'd already answered that, I guess. So someone asking what is up with what's going on with vaccination for COVID. So the federal governments and researchers and big pharma are working furiously to try to develop vaccines for COVID. We're starting to see from our federal partners a little bit of information starting to come out. There was a webinar last week and one this week about what to expect. And there is some hope that there may be enough vaccine available by the end of the year for those who are most highly vulnerable, which would be people living in long-term care facilities. But likely a vaccine is not going to be a reality for the younger, healthier populations until well into 2021. So there is a lot of good progress. They're working at warp speed. I think they call it Operation Warp Speed. So again, trying to make sure that they develop a safe and effective vaccine so that we can get everyone vaccinated as soon as they're able to produce enough vaccine. It's going to take, millions and millions and millions and hundreds of millions of doses. All right, someone wanting me, I'm going to read this almost verbatim. Can I remind people, including healthcare professionals, what the updated quarantine guidelines are? So, quarantine is 14 days, even with a negative test, and we don't even want you to get tested, right? Isolation, if you have symptoms, is for 10 days. Isolation, if you have a COVID positive test, is 10 days. And again, if you're symptomatic, at least the last 24 hours of the 10 days has to be symptom free without the use of fever reducing medicines. And we know that people are not doing this all over the county. People call us all the time to ask us about this, or we hear reports of these kinds of things happening. And we've even had a few instances where within our own agency, we've had to say, no, nope, nope, that's not quite right. If you test positive, you go home for 10 days. If you're exposed, you go home for 14. All right. Someone asking about showing hospitalizations by age group and commenting that they would like to see a breakdown of the ages, particularly for hospitalizations over 65. We do that every once in a while, but it doesn't look that much different, honestly. If you look like from 65 to 75, 75 to 85, the numbers start getting pretty small in those higher age categories. So that's why we don't break it out. And also, we're trying to stay in line with what the Alabama Department of Public Health is doing and what the Centers for Disease Control is doing. So that's why we don't break it out further. All right. We got a phone call, evidently, from some folks that watch from Tyler, Texas, who are moving to Mobile. We talked about them a couple of months ago. Just kind of odd that we have people watching Mobile County Facebook Live from Tyler, Texas, but we're glad you're there. Asking that their house is not ready and they're going to be renting an RV for the time between when they arrive and when their house is ready, and asking, are you safe in an RV? So the answer is there's no reason to think that an RV would be any less safe than a hotel room or an Airbnb or your house, as long as it has been, disinfected in between, the previous person staying there and you occupying it. It really only has to be empty for about a day or two for it to sort of naturally disinfect. But if you want, I would probably disinfect it myself when I first get there, as to not rely on the thoroughness of someone who did that before you. All right, and just a couple other announcements. I think Dr. Eishold mentioned that we're very thankful that people are wearing their masks and socially distancing. So since we have, started to see what we hope is a continuing decline in cases, but we will, as we always do, keep a close eye on that and let you know if that trend starts to turn in another direction. The only other thing I wanted to mention today, and this is really important, yesterday we released information, a news release that says negative COVID-19 laboratory tests are not required for returning to work or school. If you are at home quarantining for 14 days, or if you've been isolating after having tested positive for 10 days, you do not need a negative test to return to work. We're not requiring tests for returning to work or school. If you have tested positive, you can go about your business after that 10 days as long as you were 24 hours symptom free, and you should not test for at least 3 months, because you are no longer infectious to others after 10 days, and you could have a false positive test result if you test within that 3-month period, and it's going to keep you out of work. And you guys, the economy needs people to be back to work. Parents need children to be back in daycare and back in schools that are open, and we need to get our workforce back to work. So please do not require a COVID negative test for anyone who's trying to return to work or return to school. And again, that applies to people who are PCR positive. After 10 days, you can go back to work. If you're exposed, You go home for 14 days and you can go back to work after on the 15th day as long as you remained asymptomatic. Employers should not require a negative test for return to work. And I think with that, I'll end there unless anything's come across on Facebook.
About the chart.
Oh, yeah. So I don't, is it this way or that way? It's this way. So the chart in the your upper right corner here from your viewing is the Alabama Department of Public Health dashboard that was used to make the determination for the 14-day decline in COVID testing. This is the one that we keep a close eye on. It lags by about a week to 10 days behind, but you can see that right now Mobile is listed in a high risk category, and this is the graphic or the data visualization that's put out by the Alabama Department of Public Health that really has driven home this declining 14-day number of cases. And again, we're very grateful that you're continuing to comply with the safer at home order by wearing your mask, staying 6 feet away from people, washing your hands, covering your cough, staying at home if you're sick. And we will be back on Monday to give you our weekly update on the impact of COVID-19 on Mobile County residents. Have a great weekend.